Welcome to the Stollery Children's Hospital Neonatal Intensive Care Video Tour. The Stollery currently has two neonatal intensive care units, one located on the 5th floor of the Royal Alexandra Hospital, and the other, the David Schiff, located at the Stollery Children's Hospital on the 3rd floor. The Neonatal Intensive Care Unit is also known as the NICU, or the NICU. The birth of your new baby is a time of excitement and great joy, but when needing NICU care, this can be very scary and overwhelming. Babies that are admitted to the NICU are those who are born early, premature, are very small, or born on or near their due date, who have other challenges such as heart disease or surgical needs. In the NICU, your baby will receive individualized, developmentally supportive care, meaning that your baby will be cared for according to his or her needs and developmental stage. This video tour will give you some information on what to expect if your baby is admitted to the NICU at either the Royal Alexandra Hospital site or the David Schiff site. You will be introduced to a number of the different members of the healthcare team. It was created to help parents and families become familiar with the NICUs and hear directly from graduate NICU families on how you are an integral part of your child's care while in the hospital.
Hi, my name's Courtney. I work here at the Royal Alexandra Hospital Stollery unit. I'm a respiratory therapist and my main job is to provide ventilatory support as well as CPAP, assist with deliveries, and help you hold your baby through kangaroo care. Welcome to the NICU.
Hi, my name is Ryan. I'm one of the neonatal fellows. A fellow is a pediatrician who's doing extra training to become a neonatologist in the future. We work at both sites, at the David Schiff and the Royal Alex NICUs, and we're often one of the first people that you'll meet related to the NICU, whether it's in the delivery room, the operating room, or in the NICU itself. We're happy to answer any questions you have 24 hours a day, so please don't hesitate to ask. Welcome to the NICU.
Hi, my name is Cathy and I'm one of the head nurses at the Royal Alexandra site. I work with the entire team and help coordinate booking of tests, transfers, discharges. I'm one of the more consistent people that you will see on your journey. I've been on the FACT committee for 4 years now and I welcome you to the NICU.
The Stollery Children's Hospital has made a commitment to being a leader in patient and family-centered care. We are continually striving to improve how we provide care by placing the child at the center of care. Recognizing you, families, as important members of the healthcare team. My name is Sarah and I'm a patient and family center care coordinator. I represent the family voice in conjunction with volunteer families by speaking at staff and physician orientations and training. We also participate in reviewing new policies and procedures. We have input and help develop new educational materials, and we provide peer support for families currently in the hospital in both bedside and group settings. I welcome you to the NICU.
Hi there, my name is Barb and I'm one of the social workers in the NICU. There's 4 of us on the NICU and we're available to meet with every family who comes onto the unit because we know that nobody wants to do this journey and nobody should do it on their own. We offer a wide variety of supports such as help with parking, other practical supports as well as emotional supports. We meet with help with families and we meet with them when they have meetings with all of the doctors and other medical team. Welcome to the NICU.
Hi, I'm Julia. I'm a speech pathologist, and as an SLP or a speech pathologist, we work on feeding and swallowing. And my role in the NICU is that I'm a feeding therapist. Babies who are born early or have difficulty when they're born near their due date often have difficulty learning to eat. So I work with families and with staff to support babies as they learn and develop their feeding skills. Welcome to the NICU.
Hi, my name is Dr. Chloe Joynt, and I work at the David Schiff NICU. We care for babies who have surgical and cardiac conditions. I'm a neonatologist, and I work with a great group of people providing care for these babies. Welcome to the NICU.
Hi, my name is Hannah. I'm one of the neonatal transport team members. Depending on which site we're at, our role is different. If you meet us at the Royal Alexandra Hospital, we attend high-risk deliveries and are responsible for the resuscitation and stabilization of infants prior to transfer to the NICU. If you meet us at the David Schiff, we're involved heavily in on-unit procedures, as well as we're responsible for the transfer of infants born kind of as far south as Red Deer up to the Northwest Territories that might need a higher level of care in a more centralized location. Welcome to the NICU.
Hi, my name is Andree. I'm a registered nurse for NICU. My role is basically to look after children, neonates, and their family, and to facilitate care between different services, physician, and everybody. Welcome to the NICU.
My name is Jill, and I am one of the neonatal nurse practitioners for the Stollery Children's Hospital, NICU. I am a registered nurse with advanced education. I work closely with the neonatologists in providing the day-to-day care of babies in the NICU. Welcome to the NICU.
Hi, my name is Lang, and I am an NICU pharmacist. I work as part of a NICU team. We see patients every day on rounds. I focus on optimizing drug therapy. I ensure that medications are properly indicated, that they're dosed correctly, and also administered safely. Welcome to the NICU.
Hi, my name is Christine. I'm a unit clerk in the NICU. I am one of the people that you will be seeing at the welcome desk. Welcome to the NICU.
My name is Karen Pelche. I'm the patient care manager for the NICU at the Royal Alexandra Hospital site. My role involves working amongst a leadership team that manages the day-to-day operations of the unit. Welcome to the NICU.
Hi, my name is Delal, and I'm a neonatologist at the Stollery Children's Hospital. And neonatologist is a pediatrician who takes care of newborns, especially newborns who are admitted to the neonatal intensive care unit. Welcome to the NICU.
Hi, my name's Amy. I'm the dietitian here in the NICU. During your baby's NICU stay, I'll provide them with nutrition support, and I'll be tracking your baby's daily growth and feeding progress. When you go home, I'll provide you with the resources needed to keep your baby growing healthy and strong. Welcome to the NICU.
Hi, my name is Annette. I'm the lactation consultant at the NICU at the Stollery. I provide encouragement to our families to provide a full milk supply to their babies, either by pumping their breasts or breastfeeding their babies. Welcome to the NICU.
Hi, my name is Carol Purich. I'm a child life specialist in the NICU at the Royal Alexandra Hospital. I work with infants, children, and families to help them cope with the challenges of hospitalization and illness. The needs of children are at the core of the work I do. I embrace play and the arts in helping to meet the social, emotional, and physical needs of children and families. The NICU is a clinical environment. It has a medical feel, look, and sound. We aim to normalize the experience here. Doing little things like posting sibling artwork at bedside or family photos helps to make the space your space, and it helps us to get to know your family. Along with volunteers, I provide a play group for brothers and sisters. Sibling involvement is important. It helps to create a strong bond. I work within the team to post daily activities at the welcome desk and on 5 West. Welcome to the NICU.
Hi, my name is Sherri, the Indigenous Child Health Nurse Coordinator over at the Stollery Children's Hospital, University of Alberta. I'm originally from Northern Saskatchewan and I've lived here in Alberta for 30 years. The Awasisik Health Team will provide support for Indigenous families, such as bridging the gap between family, medical staff, and other healthcare providers, daily check-ins, community outreach with discharge planning to provide the best support for when your child goes home, and provide you with information and access to resources within the healthcare system. We also help you to navigate the Stollery to increase your comfort level. Our staff also provides events in the hospital like tea and bannock on Thursdays, drumming ceremonies 4 times a year to promote healing. We have daily smudging ceremonies and other spiritual support. We are located on the 4th floor of the University of Alberta Stollery site in room 4H2.36 across from the glass elevators. We welcome all families to come visit. Welcome to the NICU.
First, let's start where it all begins, in the resuscitation, stabilization, or RST room. The NICU team will be present for the birth of your baby. Very small or sick babies do not always cry when they are born, so it may not be possible for you to cut your baby's cord if they need attention from the NICU care team. Any urgent medical needs will be taken care of immediately so that you can see your baby as soon as possible. After birth, your baby will be brought to a radiant warmer or incubator in the RST room. These beds will keep your baby warm. They also allow the NICU team to care for your baby from all sides. Special stickers, called leads, will be put on your baby's chest to monitor the heart and breathing rates. A special saturation or SAT probe will be put on your baby's hand to monitor oxygen levels. The time after the birth of a very small or sick infant is very busy. You will see many people caring for your baby, and you may hear alarms ringing. Hearing the alarms or seeing red lights flashing can be frightening. Most of the alarms are not serious. If something serious happens, the NICU team will let you know as soon as they can. At any time, please ask any member of the NICU team if you have any questions, worries, or concerns. Asking questions is a great way to get to know the staff and understand the care of your baby. Your baby may experience problems with breathing. The NICU team can help your baby by placing a mask over the mouth and nose to help with this. If your baby continues to need more help with his or her breathing, a breathing tube may be placed in his or her mouth or nose. This tube is connected to a breathing machine called a ventilator. Some babies are able to breathe on their own, but they are not strong enough to breathe well. In this case, small prongs or a mask is put on the baby's nose, which is held in place by a cap on his or her head. This allows constant pressure to be given to the lungs by a machine called continuous positive airway pressure, or CPAP. Some procedures are done in the RST room before moving your baby to the NICU. Babies can be given nutrition and medications through an intravenous line, otherwise referred to as an IV. This is placed in a vein in the hand or foot. You may even see an IV placed in your baby's scalp. In very small or sick babies, IV lines can be put into the umbilical cord. Medications and fluids can be given through this. Sometimes another type of line is put into the umbilical cord to monitor blood pressure. The umbilical lines can also be used for blood tests. Your baby will be moved to the NICU within the first few hours after birth. Parents, family members, or other support people are welcome to come with your baby to the NICU. For the safety of you and your baby, the NICU is a secure unit. The doors are electronically locked and entrances are monitored. Parents and siblings are always welcomed in the NICU 24 hours a day and are encouraged to spend as much time with baby as possible. Other family members, friends, and support people are welcome to visit with parents. Siblings are also welcome. If you wish, you can designate a small group of individuals to visit your baby while you're not there. Welcome to the NICU at the Royal Alex. This site has 69 beds. Here at the Alex, each of the rooms is called a pod. There are spaces for 6 to 9 babies in each pod. The unit is shaped like an L. The level 3 side is for babies requiring more attention, and the level 2 side has many babies working on the transition to home. Your baby will be cared for by a registered nurse or licensed practical nurse, as well as many other members of the NICU team. The role of each of these team members are described in a different section of this video.
Definitely, I think getting involved in her care every day made me feel like her parent. Initially, it's really difficult to become attached to them because they don't feel like you're not caring for them as you would at home. And so I think all those little things that you can do, whether it's just touching them, helping with diaper changes, just getting involved and being next to them, it helps you get to know them better. And I felt that was when I started to feel like her parent, when I actually was getting to know her.
I think the NICU just kind of has a little bit of a stigma of, being scary and really intense. Initially, I felt very overwhelmed. After, I think, being here initially and just kind of seeing, and everyone's very thorough, friendly, I felt less overwhelmed after even just 1 or 2 days.
So learning how to take care of a NICU baby is definitely a challenge. We were fortunate that she, for the most part, was really helpful. And for me, it wasn't the holding, it was reading her chart every single day. But one of our nurses said, look at your baby first. That's the best judge of how she's doing today. How pink is she and how happy is she? And then read the chart. So for me, who has no medical background, reading that chart and seeing those numbers in healthy zones and reading the research paper on why she's being treated the way she did just gave me a connection to ask more questions and find out more. Things like that made me feel really connected, and that I could at least know what was going on because everything else was kind of up in the air.
My most positive moments for the NICU were actually being able to do the care myself. So when I found out that I was allowed to administer meds and change diapers and give baths, and no matter what kind of bath it was, even if it was just the washcloth sponge bath, it was all good for me. Anything I could do to be the mom in that situation was amazing to me. So every single time I got to do one of those things was like a little celebration for me.
When we first entered, it would have been nice to have known that I could be as involved as I wanted to be in my boys' care, so including being able to go through their charts, making sure that I knew around what time they're going to be doing rounds, so I could always participate in those. And I could ask as many questions as I wanted, and just being able to have the right to hear my voice being heard when it came to my son's care.
You will see many NICU team members preparing for your baby's admission. If your baby is not already in an incubator, then your baby will be moved to one. These are houses for babies that provide warmth and humidity. They also shield baby from light and noise. You may hear alarms as the monitors are switched over to the bedside monitors. These are often loud, but are usually not serious. Having a baby in the NICU can be very frightening for new and experienced parents. The many wires and tubes may make you feel scared to touch your baby. Feeling distant from your baby is a common reaction to this situation. There are many ways to bond with your baby, like touching or talking to your baby, or doing kangaroo or skin-to-skin care with your baby. NICU staff are here to help you adjust and feel more comfortable with the routines and environment of the NICU. Keep asking questions and talking with the staff. In the first few days, while mom is still a patient in the Lois Hole Hospital for Women, you will enter the NICU through the pedway. If you are coming from another hospital or once you are discharged home, you and your guests will enter the NICU through the welcome desk entrance. For the safety and security of all the babies in the NICU, you will be asked to identify yourself before entering the NICU for the first few times, or until you get to know the staff. You are welcome to see your baby at any time. When entering and leaving the NICU, and before touching the babies, it's important for all visitors and caregivers to wash their hands. All babies who are sick or born early have weak resistance to infection. Infections can be very harmful to all babies. Hand washing decreases the germs your baby is exposed to. The NICU team does bedside rounds for each baby every morning. The team includes you, the neonatologist, also called a neo, a neonatal nurse practitioner, NNP, or an NICU fellow, your baby's nurse, the charge nurse, a dietitian, a pharmacist, and a respiratory therapist. The morning rounds are when the team talks about each baby's needs and makes a detailed plan of care. You are an important member of your baby's team. This is an opportunity for you to share how you feel your baby is doing. Ask questions and listen to the team share information about the health of your baby. You are welcome to participate in the decisions and discussions about the care plan for your baby. Healthcare team members are available throughout the day and night should you have any questions. If there are significant changes to your baby's plan of care, the healthcare team may need to contact you when you are not at the bedside. It's important to leave reachable telephone numbers with the nurses at the bedside. You are also welcome to call the NICU at any time, day or night, to check on your baby. You'll be given your baby's hospital ID number to identify yourself when you call. For the protection of you and your baby's privacy, health information will only be provided to parents. We also have a mother-baby unit known as 5 West. This is still part of the Royal Alex NICU, but is located on the 5th floor of the Lois Hole Hospital for Women. There are 6 double rooms on the unit. Nearing the end of your NICU stay, you may be asked if you would like to move to this unit. It is unique in that it is a transition unit to home. It allows moms to stay with their babies and be involved in their care 24 hours a day. Your baby may be transferred to other neonatal units in Alberta. Other hospitals in northern and central Alberta that have NICUs are the Grey Nuns, Misericordia, Grand Prairie, and Red Deer. These hospitals might be closer to your home, making it easier for your family to be with your baby. If your baby needs surgery or to see other specialists, they may need to be transferred to the David Schiff NICU at the Stollery Children's Hospital in Edmonton. This NICU specializes in the care of cardiac, surgical, and critically ill infants. The David Schiff NICU, or DS, is located at the Stollery Children's Hospital in the same building as the University of Alberta Hospital and has 18 beds. Most often your baby is born at the Royal Alex, then transferred to the DS by our special NICU transport team. This team consists of a transport nurse or registered nurse and a respiratory therapist. Your baby will stay warm in the transport incubator and will be transported by ambulance. When arriving at the DS, your baby will be greeted by many members of your healthcare team. Your baby will be moved from the transport incubator over to a radiant warmer. The DS NICU is laid out differently from the Royal Alex. Rather than being in pods, the unit is divided into rows. Babies that stay at the DS are primarily those born with congenital heart defects and those that require surgery. You may see familiar faces, as some of the doctors, nurses, nurse practitioners, and fellows work at both sites. Most moms require care after the delivery of their baby and will be on a postpartum unit to rest and recover. It is difficult for mums to be on a different unit or at a different hospital than their babies. Some ideas that may help with this include having family members send pictures and videos of your baby to you. You're also welcome to call the NICU for updates on your baby at any time during the day or night. A staff member is always available for you to speak with.
What I found very stressful was being separated from my daughter. So in normal circumstances, you have a baby, you're in the hospital for a little bit, you go home, and that's yours, and you're in the same room, and that's amazing. Having that separation, I had a tremendous amount of guilt. Anytime I would go home to sleep, I felt like I should have been there, but it's almost impossible to be there 24 hours a day. Like, your heart is literally in two separate places. I think I coped by leaning on the staff, because I would cry almost every day when I had to leave, and they were like, you know what, your daughter's in the best care. Another thing that helped me cope a lot was by calling in and checking. They were amazing with, like, you have a number, you have the ID, and you can call anytime. So I would call upwards of 8 times a night, some nights when I was having a bad night. And just to hear them say that there was no changes and everything was okay, gave me the reassurance that, okay, I'm okay here and she's okay there.
So we're from Winnipeg, and Jackson was born in Winnipeg and flown out to Edmonton approximately 10 hours after birth, which meant that we could not fly out with him at the time of night, and it was a weekend, so we flew out the next morning. So we were separated for approximately 24 hours until we were reunited with him, and it was hard. It was heartbreaking, devastating. Being separated was the worst thing I've ever experienced, and it got better once I saw him and hearing updates from the nurses calling us, but it was heartbreaking.
And for me, the most stressful thing, probably making sure my family's taken care of, making sure everything was done at home before we came, make sure we have people to do it, but also feeling like you have to update everybody when you just want to be here and you just want to be with your family, with your son, with like the newborn. It's just stressful being away.
We welcome families into the NICU at any time so that they can be with their baby. Once mom is discharged from the hospital, she can come and spend time with baby as well. It can often be overwhelming walking into the NICU for the first few times. This is a common reaction. Your baby may have a breathing tube or mask over their nose to help with breathing. Your baby will have stickers or leads on their chest and a Band-Aid that we call a saturation probe on their hand or foot so that their heart rate, breathing rate, blood pressure, and oxygen levels can be monitored. They will often have intravenous IV lines in either hands, feet, umbilical cord, or scalp. There may be alarms ringing. If it is something serious, your healthcare team will inform you. Your baby's primary doctor at the David Schiff NICU will be the neonatologist. There are often other specialists involved in the care of your baby, and therefore you may meet a number of different doctors. The cardiologist and surgical team comes to the unit daily to discuss each of the babies under their care. Your baby's neonatal team will also come around daily for rounds. During rounds, your baby will be discussed with you and the healthcare team. We encourage and welcome your input into developing plans of care for your baby. Being a parent in the NICU can be difficult. The NICU team will try to make you feel comfortable and involve you in your baby's care. Remember, you are welcome in the NICU at any time, day or night. We encourage you to spend as much time with your baby as you can. Siblings are welcome to visit. You may bring other family and friends into the unit to see your baby as long as they are healthy. There is a maximum of 3 visitors at the bedside at one time.
Probably the most positive experience being in the NICU is having the kids be allowed to come in and hold him. Like, I definitely see with both of them, with Andree and Paige, that they love coming here to hold Jared, even if it's only for a couple minutes. It really, it makes them happy, and they're always asking to hold him, so I feel like it is a way for them to connect with him without him being at home. Also, I guess it's in the same, but letting our parents be here as much as they can, even if I'm not here. So having the list of people that can come without me being here, just knowing that if I'm not here, somebody else might be here, either just talking to Jared or holding him, and that is important to me.
The team will keep you updated on any changes that happen with your baby during the NICU stay. If your baby is sick, you may not be able to hold your baby in your arms right away. Easy ways of holding and being close to your baby will be explained to you by the NICU team. Placing your hands on your baby and holding gentle, steady pressure is one example. Once your baby is more stable, the NICU team will teach you how to do skin-to-skin care, also known as kangaroo care. During kangaroo care, your baby will be placed on your bare skin. This allows your skin heat to keep your baby's temperature normal. It allows the baby to bond with you in a way that is safe and least disturbing. We ask that you plan to spend at least 1 hour with your baby for skin-to-skin.
Some words of advice I would have to give to new moms or moms and dads coming into the NICU would be to be here and be involved in the care, ask a lot of questions. There's a lot of acronyms being used all the time. Everyone's very welcoming and explain everything very thoroughly. Also would be to get involved in the care, like be hands-on as much as you can. It's your baby, you're here for them. They are very familiar with your voices and even just your smell. And I think being here, I've seen my son thrive even in the last few weeks.
As a parent, the NICU experience is a bit of a roller coaster with its ups and downs. Your baby will have good days, but they may also have setbacks and bad days. In the early days or weeks, it is common for us parents to have many challenging emotions, including feelings of loss, sadness, fear, and even anger. Many parents continue to feel distant from their baby. It's hard to feel like real parents in this highly medical environment. Some things that parents have found that have helped include personalizing your baby's bed space. This can be done by bringing in a few personal belongings such as pictures of you and your family and a special stuffy. There are whiteboards at each bed space where you, the parent, can write messages to the staff or to your baby. These tools are available at both the Royal Alex and the David Schiff sites. Also available for families are milestone calendars where parents can document milestones throughout the baby's stay. Please ask about the parent pathways and treasure life beads, as these are good tools to use for parents when speaking to your baby's nurse or remembering to complete tasks at various stages in your baby's NICU journey. It's okay to share your feelings with people you trust on your care team, including the bedside nurse or your social worker. Be assured that over time, parents do adjust to their baby being in the NICU. You will get to know your baby best and will be the most consistent caregiver for your baby. I hope this video has been helpful in bringing some light into the NICU experience and what to expect after your baby is born. Remember to ask the NICU care team questions, even if it means asking them the same question several times. Many families choose to keep a notepad or journal with them to write down notes and questions for the care team. It is hard to remember everything you are learning, especially when stressed, tired, and concerned for your baby. No question is a silly question. All of the NICU staff are here to help you and your family. Patient and family-centered care is proud to offer various forms of peer support to our Stollery inpatient families in both group settings and one-to-one at the bedside. These programs use fully trained volunteer families who have all had experience in the NICU with their own child and now come back to offer support to inpatient families. At our weekly family coffee hours, We have graduate families that join the social work team and inpatient families for informal conversation and light refreshments. Our one-to-one bedside peer support program is called the Family Mentor Program. Family mentors visit inpatient families at their bedside every 2 weeks and engage them by being a listening presence and having open, honest, judgment-free conversations that foster strength, empowerment, and hope in the inpatient family. You can ask your nurse or social worker if you'd like to have a visit from a family mentor.
Coping with the stressful moments in the NICU, we did that through leaning on each other, me and my partner, and leaning on family, and then also just having that trust in the doctors and the nurses, and that they knew what was best for our baby and that we would be okay. My most positive memory from the NICU was when we were in over Christmas time and my uncle came dressed as Santa Claus, and we just got to have that first kind of Christmas experience, and that was my favorite. Advice I would give to future NICU parents is that it's going to be a long journey, and it is a really difficult one, but the doctors and nurses are going to be honest with you, and they're going to support you, and they're going to get you through it, and hopefully you can get a little bit of trust in them, and just good luck, because 5 years down the road it feels really awesome. Lachlan is doing great now. We are in kindergarten. He's 5 years old. We're playing. He's enrolled in hockey. He does soccer, and he's got lots of friends.
So this is Hannah, and with how she's grown and progressed, she's doing amazing. She is 5 and she's in kindergarten. Hannah was diagnosed at 20 weeks with a giant omphalocele, which means the majority of her liver, intestines, and stomach were all born on the outside of her body, covered in a membrane sac. It's a fairly rare diagnosis, and hers was exceptionally rare because of its size. We needed a conservative approach, which ended at about a month when she needed surgery, and then she had a wound vac for 9 months to help close it, and then at 2.5, we got full muscle closure and full repair. So basically it was like closing a giant hernia, so she looked like a little pregnant 2-year-old. And now she has a beautiful tummy with a fantastic looking scar, and she's very unique with her no belly button.
Now that my baby is older and our family is doing well, I've become part of the NICU Family Advisory Care Team. Or you may hear us talk about the NICU Fact. This is a group of graduate parents, neonatologists, staff, and hospital leaders who work together to improve the care of our babies and the support of families while in the NICU. It is this group that helped create this video. We want you to know that we understand that this can be a very uncertain and emotional time, and that there are many people thinking of you and your baby. Please review this video as many times as you need and share it with others who will be supporting the care of you and your baby while in the hospital. Lean on the people around you, including your healthcare team, as they can be your strength and support if you let them. And welcome to the NICU.